for the have registered for this session. So good afternoon, everyone, and Assalamu alaikum. I am Dr. Amber Sultan. I'm the director and the moderator of today's educational grand round. I welcome you all to the Department for Educational Grand Round. Today's title for presentation is Emotional Intelligence, a Skill That Matters. The format of today's session is half an hour presentation by Dr. Javeria Rahman and followed by panel discussion and question answer session. For the participants who have joined online, if you have any queries, any question, please fill the Google form. And for that, the link has already been shared in the chat box. Okay, so I would like to introduce today's speaker, Dr. Javeria Rahman. She's currently working as a senior instructor in the Department for Educational Development and Department of Pathology. Pathology and Laboratory Medicine. She has done MHP from Dow University of Health Sciences, and currently she is the course coordinator of advanced level course on curriculum development in health professions education. She is the course coordinator of introductory short course in health professions education, and she's also the course co-director of cognitive psychology course office by DD. So I welcome to all the panelists, and we have invited some panelists who have joined online as well as in person. So over to you, Dr. Javeria. Thank you.
Thank you, Dr. Amber, for your kind introduction. Bismillah ar-Rahman ar-Rahim. Right, thank you. So yes, today I'm here to talk to you about emotional intelligence for this educational grand round. Let's proceed with the presentation, with which I began with this declaration that I do not have any financial relationship with any entities for the producing, marketing, or reselling, distributing the healthcare goods for the past 24 months or more. So this is the overview of today's presentation. We will be discussing about definition and theoretical models that are there in the literature for emotional intelligence, and then the components, and most importantly, the application of emotional intelligence in terms of what the literature suggests has been happening in medical education, along with the challenges and the recommendations. So what is emotional intelligence? When we talk about it in the simplest form, it is actually the capacity to identify and to manage the emotions in oneself as well as in others. So it's the ability to recognize and to understand emotions in yourself and others, and then to use this information, use this awareness to manage your behavior and your relationships. So we can see that if you have a look at this quote from Aristotle, that anybody can become angry, that is easy. But to be angry with the right person and to the right degree at the right time and for the right purpose and in the way that it is rightful, and is not with, this is something which is not within everybody's power. And definitely it's not easy. So we can see that the concept of thank you. Yes, so we can see that the concept of emotional intelligence is not something very new, but yes, talking about this explicitly, this has been coined, the term has been coined much later. But we can trace it back to for about like 2,500 years ago, when this quote tells us about the concept of emotional intelligence here. So how to, use your emotions intelligently. Uh, just talking a little bit about the history, that it was like around 1920 when Thorndike actually introduced the concept of social intelligence. And at that time or before that time, nothing in terms of intelligence was thought of except for the cognitive element. So what Thorndike did was that he introduced the right. So what Thorndike did was that he introduced the concept of social intelligence, and that was considered as the ability to get along with the with other people in the society, basically to understand and the motives and the behaviors of oneself as well as for the other. But it was not labeled as emotional intelligence; it was taken as the concept of social intelligence there. And then later, it was David Wexler who identified the concepts, or who basically added to the literature in terms of the non-intellective factors. And I will be needing that. I'm apologies for the disturbance here, but I'll be needing the screen now. Okay. So can I continue? Yeah. Okay, so yes, so we were talking about David Wexler after the Thorndike concept. So then later it was Gardner who actually talked about the concept of multiple intelligences, giving the theory that there is not just one single intelligence that takes play or that plays part in one's life, but there are actually the abilities which actually make up the multiple forms of intelligences. And it was not until 1990 that Salovey and Mayer were the first one who scientifically coined the term of emotional intelligence. Now I've happened to hear a talk by Professor Salovey, and there was some interesting fact that he shared, which I will just come to that later. But the concept actually gained popularity when Daniel Goleman, published his book on emotional intelligence, Why It Can Matter More Than IQ. And that was in 1995. And it was then that the concept of emotional intelligence became, it spread like a wildfire. And then it kept on coming in the literature as Baron talked about emotional and social component together, talking about emotional and social intelligence, and introducing the term of emotional quotient there. And then finally in early 2000s, when Petridis introduced a trait model for emotional intelligence, talking about the inherent ability. So theoretically, we can see that in the literature, there are two main streams. One is the ability model, which defines emotional intelligence as a cognitive ability. And then there is a mixed or trait model, which goes side by side because both share the mixed is actually having the component of the trait aspect as well as the ability aspect. And trait is wholly, composed of the trait aspect of the emotional intelligence. But mixed and trait, they go side by side in terms of dispositional factor that defines emotional intelligence. So the ability model, as I just mentioned earlier, was presented by Salovey and Mayer in 1990. And they came up with the concept of emotional intelligence as a cognitive ability, so much so that it is actually the ability of a person to perceive, to appraise, to express emotions, um, think through them, understand emotions, and then use those emotions and that awareness in terms of reflectively regulating the emotions that will turn out or express themselves in terms of their behavior with the others. So basically, they defined it as a function of cognition and intellect. And they propose that it is measured by the maximal performance, such as identifying the facial expressions on a given photograph. So they have developed this tool, which is known as Mesquite tool, MSCEIT. And they are actually measuring they are giving certain facial expressions and they are trying to measure it by the maximum performance. And yes, the talk I was talking about that Professor Salovey mentioned was that when they came up with the idea, tried to publish the idea for emotional intelligence for the first time, they tried for the best of the journals then, but somehow they kept on, getting the article somehow kept getting rejected from the best of the journals because the people at that time, the psychologists as well as the scientists, they were not convinced of the idea. And it was only after, but they did get to, manage to publish the article somehow in one of the journals. And then after 5 years, they came across their own term again, when Goldman actually gave them the credit for introducing the term for emotional intelligence and got inspired by that. And then he got that his own book published, which actually sold 5 million copies and has been translated for about 40 languages in the world right now. So that shows us that, no thought goes waste, right? So we need to keep thinking and keep innovating. Then as I talked about the mixed model, so basically Goldman talked about the mixed model, and Baron also, they talked about interconnecting skills and abilities, that is combining social competence with the personality traits. I came across this recent article in which they have also proposed the idea that actually this mixed model can be, divided into two streams. One could be taken as a trait model because, again, this is taking through the self-reporting measurement, and such as the Baron model. They took it as the example for measuring of the attitudes and motivation. But again, those are self-reporting measures. And then there could be behavioral aspect of the emotional intelligence, in which the manifestation in real context by taking external informants observations can be taken into account, with which they have quoted the example of the emotional social competence inventory that has been devised by Goldman and his colleagues. So talking about the trait model, this is an individual entity. Like the trait model is talking about emotional self-efficacy, basically. That is where one is concerned with the perception of his or her own emotional abilities. So basically, it relies upon the self-reporting measure. And it is talking about, again, the same concepts, but a little differently when they are talking about adaptability and assertiveness, emotional perception of self as well as for the others, expression management, regulation, self-esteem, self-motivation, social awareness, stress management, empathy, happiness, and optimism. So we come to the point where we think, okay, so what is the difference between these models which are there in the literature? Like, is it the ability, or is it the mixed thing, or is it the trait? So what we see here is, although all these models, they talk in terms of, describing the emotional intelligence or defining emotional intelligence in multiple or different ways. But the main or essential difference lies, first, as the cognitive or non-cognitive ability. And the other is the idea of measurement that is behind this concept. As we could see that the ability model is basically measured through the maximal performances, while the trait model or the mixed model is mainly measured through the self-reporting questionnaires. So coming to the basic elements of emotional intelligence, what it is, when we are talking about, it's about understanding, it's about awareness, it's about management. So we can broadly categorize, and we will be surprised to see that in literature, we see this, there's so much of overlap between all those models, which are distinct, yet they have these overlapping competencies that they're talking about in one way or the other. So the four main concepts that we talk about emotional intelligence here are the self-awareness and self-regulation, social awareness, and then it comes the relationship management. So you can see two of the aspects are related to self and two are related to the others or the social aspect of the competency. So the personal competence, which is more of the intrapersonal value, is talking about the self-awareness and self-regulation. And the social competence or the interpersonal interaction is talking about the social awareness and the relationship management here. So self-awareness is the basic, fundamental, and the most crucial skill when we are talking about emotional intelligence. And it forms the foundation of EI, because it is basically getting aware of yourself. Now, one must, say that, okay, who knows better, who knows myself better than me? But still, this is the conscious effort that they are talking about, to knowing about your emotional awareness first. So much so that you need to pay attention to actually try to name your emotion, right? Not your feeling, but your emotion. So in that terms, it requires a conscious effort to be aware of yourself in terms of emotional awareness. When we are talking about that, you need to be able to identify what exactly is the name of that emotion. You should be able to differentiate between irritability, anger, that may transform into rage, right? So the extent to which an emotion can vary, that you should be able to identify that, which of course comes with practice, not just like that, right? So with that comes the identification of triggers also. What are those triggers in your daily routines, in your interactions, in your life that make you come across those emotions, right? So you need to pay attention consciously to those triggers. And then how do those triggers, very interestingly, we can see physiologically affect, which may actually, if you pay attention, you can acknowledge the physiological changes. For example, what do we feel when we are experiencing fear or anxiety? Any idea? How do you see your body or your physiology reacting to it? Any comment from the audience? Okay, so you feel trembling, yes, and sweating, right? And the pulse goes up, the heart rate increases, right? So yes, clenching of the fists. Okay. So see, there are multiple physiological and physical reactions that if you pay attention, which you're doing it unconsciously when you are actually experiencing those emotions. But when you start paying attention to those and you see, okay, so this is something which is now I'm about to feel, because this is the change I can feel right now. So that becomes, awareness for your particular self, for that particular emotion. So it does not stop only on that, but actually it also, talks about identifying your own strengths, your own capabilities, your own limitations that would eventually contribute to those emotions, right? And no emotion is bad. Every emotion is there, right? It's just about the extent to which you allow it to control you, or you control it first, right? So coming about talking about self-regulation, again, self-regulation is about self-management in terms of emotions, in terms of self-control. So it ideally talks about the appropriate expression of your emotion, right? How do you express your emotion? That is talking about self-regulation and self-management. And it also talks about an element of motivation when you're talking about self-regulation, to keep you motivated, to inculcate, the feeling of positivity, optimism, and the sense of achievement that will, keep you motivated in terms of achieving your goals, in setting up goals, in achieving those goals, striving hard to work towards them. And again, adaptability to change. So these are all the factors which will help you develop a self-regulated aspect of your emotions. Then we come to the social aspect that is where the social interactions come into play. And there, the fundamental thing is the empathy, right? And we all know that empathy is something which is actually the one emotion which, as human being, we need the most, right? From for ourselves as well as for the others, because it comes to so much so that in a simpler way, understanding others, how others feel, the sense of developmental needs, emotional needs for the others, and then accordingly, appropriately responding to those needs. um, it also involves whatever is happening around you, because it is about social interaction. So you need to be aware what are the dynamics with the people you are interacting with. Especially here we are talking about the workplace as an example for the power dynamics, and the factors that might influence your social behavior or the social awareness. So again, you need, when you start paying attention to that, will help you develop your social awareness. And all those things together will eventually reflect in your relationship management. So how do you manage, how do you tend to influence people around you? How do you tend to inspire people around you? How do you take care of the needs and developmental requirements for others around you, right? And then how do you collaborate and manage your conflicts? So if you are self-aware, you tend to emotionally, you tend to work on your emotions in terms of regulating them, and then you learn to respond to them accordingly, not react, respond, right? And then you manage your social interactions in that way by responding to others, and that will actually translate into your relationship management. So coming to the concept of emotional intelligence in health professions, I would just like to share the analytics here, which I happened to come across while I was searching on the PubMed. Of course, you would find it entirely different, a lot more literature there on Google Scholar, but I couldn't find the analytics there. But as you can see here, you can see the trend of the articles or the literature here since it has been growing. You can see the elevation there in the graph, how the work on emotional intelligence is particularly growing and taking a huge leap here in terms of literature for for health professions. So when I talk about health professions, it's not just the medical aspect, it's the nursing, it's the dental, it's the allied health professionals, be it students, be it faculty, be it practitioners. So it's all about that. And when I looked into searching for emotional intelligence last 10 years, you can see that almost 50% of those articles are actually published in last 10 years, right? So it's still a new field in terms of a lot of opportunity to work on it and to publish, to find ways to look into EI for health professions. and medical education. Talking particularly about medical education, again, you can see and appreciate the trend here, that it's also not only along, the entire health professions, but also talking about medical education in particular. You can see the trend that is, again, it's growing and it's been increasing year-wise. So when I looked up into the literature, I could find, and I could just only summarize here out of the many studies that have been done in medical education, that people have studied and found a positive association of emotional intelligence with the quality of patient care and safety. Most importantly, also personal well-being, managing stress and reducing burnout, adding on to resilience, then patient satisfaction and doctor-patient relationship, clinical decision-making. Of course, empathy is there as a separate entity also. And then professionalism, better job performances at workplace, and their own satisfaction with their, job performance. And then leadership skills, communication skills, interprofessional skills in terms of their relationships and collaborations, and improved organizational climate as well. This one study by Arora et al. In 2010 actually looked into the perspective of emotional intelligence in terms of ACGME competencies. And they did this review and found that actually EI has a role to play in all those 6 competencies that we find in ACGME, that is medical knowledge, patient care, professionalism, interpersonal and communication skill, practice-based learning, improvement, and system-based practice. And there is another very recent study that I found that is published this year, in which Dot et al. Actually, again, looked this application of EI in terms of good medical practice guidelines, which is issued by GMC UK, General Medical Council UK. And they also concluded that overall, in their review, they found that there is a positive relationship of emotional intelligence, whether they are looking into the domain of knowledge, skill, and performance, or safety and quality, or communication, teamwork, partnership, or even maintaining trust. So in particular, when I looked up for medical students, I found that they have been exploring the areas and have been associating EI with better student, with the students' wellness, which is again one of the very important aspect when we are talking about the wellness and well-being of the students. And then the academic performance and the teamwork and the clinical performance. And you can see some of the articles here, which are the recent ones, and you can see that they have been looking into, the overall study of emotional intelligence, assessment of emotional intelligence, relating it to empathy, relating it to physiological, psychological distress and burnout, critical thinking, and even conflict management styles, and so on and so forth. I also, was interested to see if they have taken into account the perspective of medical educators in terms of emotional intelligence. And you can see a couple of studies there where they have found that EI is also associated with the teaching effectiveness of an educator or a teacher. And so much so that they tend to create a learning environment that is motivational and that is inclusive to the students, addressing to their emotional needs in terms of management, classroom management, behavioral management, conflict management, and addressing the challenging situation in the class also. It promotes teacher-student relationship, and it has been found to be associated with mentoring and role modeling, of course, in a positive way. Because on the other hand, it also talks about the management of stress that an educator might feel, because everybody, we are human beings, whether the person is a student or a teacher or educator. So there must be some emotional element connected to that particular, a topic or a session. And you need to take into account all the emotional needs of the students as well. And here you can see a few, examples here that I've listed about exploring emotional intelligence aspect in the faculty and the educators in the clinical as well as the non-clinical settings. So for medical education, when we talk about teaching, learning, and assessment of EI, we can see that it is, again, a multi-dimensional construct as we went through those concepts. And because it is encompassing the cognitive and the affective skill components. So the good thing is that all theorists, they believe, no matter what is the construct behind it, but it can be developed, enhanced, and improved through effective training. And there are a couple of interventions that have been reported in the literature for improving EI, which included simulated patient, EI coaching sessions, mentoring, role play, reflection exercises, and even didactic lectures in terms of introducing the concept of EI for the medical students. However, there were, again, the variation in the method of assessment or measurement, because, as we said, that depends upon which model you are catering to. So again, you can see there are certain studies that have been talking about suggesting the idea of incorporating the aspect of emotional intelligence in the curriculum or the studies for medical students. So as I said, there have been proposed ideas about, introducing the concept of emotional intelligence in the medical education curriculum, or even the nursing or the dental curriculum. There are certain challenges to it, because you need to identify first whether there is a need of introducing, how much is that of value, which is somewhat supported by the literature, as we just went through the associations that have been determined. But then again, it comes to the choice of the model or the construct, whether we are talking about ability, we are talking about the trait, or we are talking about the mixed element. So again, this need to reach a consensus amongst the experts that how they would like to explore or implement and eventually go forward with the idea of emotional intelligence. So they need to construct and operationalize the definition and the framework according to the intended outcomes for the medical education. Then again, as there is no consensus on the model in terms of application for medical education, there need to be consensus for the assessment also, because again, that has to be aligned with that conceptual framework that would be taken into account. A number of educational interventions have been applied and they can be explored further. But the thing is, when you are talking about the research element in terms of your findings for its implications, there hasn't been any cause and effect relationship yet. Most of the majority of the studies have been correlational. They have determined the associations, but haven't determined the cause and effect relationship between the constructs or the aspects. So if one is to think about introducing the concepts of emotional intelligence, there need to be, a conscious effort in terms of determining the context, whether it be educational, cultural, or developmental for that particular society. So with that, I would like to end my presentation with this quote, that too often we underestimate the power of a touch, a smile, a kind word, a listening ear, an honest compliment, or the smallest act of caring, all of which have the potential to turn a life around. Thank you very much.
Thank you, Dr. Javeria, for the wonderful presentation. And now, can you hear me? Okay, so now the session is open for discussion, panel discussion, and the question answer session. We have shared a link. If you have any query, any concerns, any clarification question, then you can submit your questions via the link, via the Google form. And the link has already been shared in the chat box. We have invited We have invited some experts for the panel discussion. Our first panelist is Dr. Hadia Pasha. She's here in person. She's an associate director, counseling services and wellness at Aga Khan University. She is a clinical psychologist with more than 25 years of experience of practicing and teaching mental health in educational, clinical, and community settings. Dr. Hadia holds a PhD in clinical psychology from the University of Karachi. Her main areas of interest include mental health, youth mental health, prevention and treatment of mental illness, raising awareness and reducing stigma related to mental health issues. Our second panelist is Dr. Nagma Naeem. She has joined online. Assalamu alaikum, Dr. Nagma. She's a physician with PhD in medical education, complemented by 24 years of experience in medical education at undergrad and postgraduate level. She was the chair, examination board, executive chief proctor, National Board of Medical Examiners, chair, task force for curriculum renewal, and associate professor at the Department of Medical Education at the College of Medicine and Health Sciences, United Arab Emirates University. Her key areas of interest and research include assessment, emotional intelligence, faculty development, and curriculum development. Our third panelist is Dr. Sonia Heather. Dr. Heather completed her doctorate in clinical education from University of Warwick, UK. She worked as a research fellow in the Department for Medical Education, School of Medicine, Dundee University. Currently, she is working as associate professor and academic lead of postgraduate teaching and research in the Center for Medical Education, School of Medicine, Cardiff University. So I welcome you all, and I would like to invite Dr. Hadia Pasha to please come on the stage, and Dr. Javeria Rahman. And the session is open for discussion. So if you have any queries, if you have any question, so please share your questions via the Google form. And the link has already been. So we will take questions from the participants who have joined in person as well as online. So over to you, Jeev.
First of all, thank you, Dr. Javeria, for a wonderful presentation on emotional intelligence. It is something which I personally like and read about. I just want to understand. I have two questions. One is like, how would you simply differentiate between feelings and emotions for a common person? And secondly, if you talk about measuring the level of stress in academic performance, then how can we actually keep emotional intelligence in mind and say that the student's performance is poor because of stress, or actually the student is not able to study properly if he has some cognitive deficiencies? So how would one label emotional intelligence as a bias, and how to reduce it? So that's it. Thank you.
Okay, thank you very much. I would like to respond to the first one first, differentiating between a feeling and an emotion. So feeling is generally thought of as something that's more sensory in nature, and emotion. So you can say that any emotion or feeling begins with arousal, some physical sensation, then you interpret that, and then you feel an emotion. So you see, feeling is more fleeting, it's more sensory. Emotion is more cognitively processed, I would say. And that's why when we talk about emotional intelligence, we do not talk about feeling intelligence, because you need to be intelligent to process if I'm feeling frustrated and that's why I'm angry, or someone has done something which I think is not fair to me, that's why I'm frustrated, I'm angry. And realizing, again, if we go into another level of discrimination, realizing that frustration may lead to anger, but may not be the right response, because we if we are frustrated, we may not need to defend ourselves, which anger serves. Now I'm going into the utility of emotion. So anger is basically an emotion that we need to protect ourselves. But then when we get frustrated, we get angry again. So emotional intelligence would be to understand and develop the ability to process and then label the emotion correctly. So I'll hand it over for some other panelists to answer the other question.
So any
Bias
comment from the speaker and from the panelists who are online? Dr. Nagma, Dr. Sonia, would you like to comment? Ji, Dr. Sonia, your mic is on mute. We can't hear you. So any comment, Dr. Sonia, your mic is on mute. Okay, so we can take comment from the speaker. Dr. Javeria, would you like to add anything?
Yes, thank you, Dr. Sara, for your question. So what I understood from your question is that how would you cater to the stress in terms of the performance of the student? And emotional intelligence, yes. So when we look at it theoretically, again, there are the measurements of the psychological aspect of it, because these are the primarily the field of psychology, whether it could be the education psychology related to that. But then again, the tools for measurement are again based on those inventories and the questionnaires, Dr. Hadia, right? So again, those are the elements in terms of assessment when you're talking about particular, the scoring or the identifying the element of stress or the emotional intelligence there. But again, they reflect in the behavior of the student also. So there has to be, when we are talking about being aware of ourselves as well as for the others, so we are taking into account not the responsibility for our emotions, but also in terms of addressing to the emotions of the others with the persons we are dealing with. So again, that would, might indicate the level of the change that you might expect from the other persons while interacting. So that is one perspective. I would like Dr. Hadia to share that also.
Thank you. So it depends on the age of the student as well. For example, if we talk about medical education, we know that students have reached here because they have at least an average intellectual capacity. They have cleared the examinations, they have cleared the interview processes and everything. So this discrimination between whether a student is even capable enough to learn would be more relevant at an earlier stage when we actually do not know if the student is cognitively developing, intellectually developing. By the age of 18, abstract reasoning has also developed. It starts developing after the age of 11, 12. So we would expect a student who's 18 plus to have, and who has gone through competitive examinations, that they at least have. Now, in my experience, students in higher education, when they underperform, it may be because they were forced to come into a field which they never wanted to be in, so the motivation is an issue. Students, most of all, are unable to keep up with the studies because of lack of self-discipline, which would relate to the thing emotional regulation in emotional intelligence. So most of them, when they get distracted, they cannot come back to studies. So social media is the biggest villain these days. वो Insta पे चले जाते हैं 2-2 घंटे 1-1 घंटा, stuff like that. Then there are students who took help for depression, anxiety throughout, and they kept on achieving completely. Why? Because they became aware of how they were being affected by their emotions. They kept on working on them, and they were self-regulated. So that, I mean, one of them would say, ma'am, fine. I mean, if I'm depressed, does it mean I do not study? No, I do study. If I have to do it, I'll do it. So at our level for medical education, I would say if a student is underperforming, we need to look at the motivational factors and the self-regulatory factors rather than anything else.
Okay, Dr. Sonia. Dr. Sonia,
Right.
and then
Thank you very much. Thank you very much. So yes, the host unmuted us. So thank you for that. I would just like to bring this to one point that, what is the role of medical schools here actually? More and more evidence indicates that, medical schools, when students enter into their training program, the level of EI starts declining. So the important question here is what is happening within the med schools that is actually propelling our future doctors in training to demonstrate a low level of emotional intelligence. And just capitalizing on what Dr. Hadia and Javeria has said, I would just like to point out that I think it's high time we fundamentally highlight the role of emotional intelligence, not only for the students and residents, but I also think staff and faculty members also need it. And we don't really need to go into the mammoths of it, perhaps beginning with just micro practices, for example, mindfulness or grateful writing, practices which can actually be the beginning point. And then we come to think where best we can align it within the curriculum, or perhaps can it be somewhere on the sidelines? But I think it's time we really need to put our heads into it and start thinking how best we can include it.
Thank you, Dr. Sonia.
Thank you.
Dr. Nagma.
So adding to the perspectives of all the other participants, I think we need to also think of emotional intelligence, because if we say, and we've seen in the literature that most of the outcomes that we are looking at, the outcomes which were ACGME outcomes or the GMC outcomes, or even our own AKU outcomes, the attributes that we want in a medical graduate, if most of them are linked to EI, then should EI be a part of the curriculum, be a part of even selection criteria? And does it need to be addressed only at the medical school level, or does it need to be included at the postgraduate level and even as a continuing education thing, so like a continuing professional development thing? So all these questions are pertinent, because if our outcomes are so much related to emotional intelligence, then investing time in training, in assessment, in honing those skills, if even when if at the start you have a lower level of EI, and literature has shown that it can increase over time with appropriate training, and some of the measures were named by Dr. Sonia Heather, like mindfulness practice, like coaching, like 360 degrees rater evaluations, like self-report measures. So if it can be measured, then once we know the level, then can we also increase it throughout our training as a conscious effort? So I think that also relates to stress and underperformance of students or of trainees, even of professionals. So why the stress is there? One, what kind of a workplace are we looking at? For example, if we look at medicine, there is overwork, there is lack of sleep, there are um, competing requirements, you have multiple responsibilities. So all of these are inevitably going to lead to stress. So the main point here is that, yes, the stress will be there. You will feel it. You will, as a consequence of that stress, maybe feel incapacitated. So how can the emotional intelligence training help you to deal with stress, to channel the stress in a constructive way so that it improves performance rather than hinders it?
Okay, thank you, Dr. Nagma. Okay, so we have few questions from the participants who have joined online. First is, how much close is decision making to emotional intelligence? And is it about that the decision will be more or less emotionally driven? Yes. So, yeah, Dr. Javeria.
Yes, thank you for that question. Well, the literature reports actually the studies that have been conducted in cognitive or neurocognitive sciences, that because there is a physiological connection, as we see, that the emotions, it's the actual interaction between the limbic system and the cortical function that is translated into the action and the behavior and the decision making. So what we found, what we can look into the literature is that there is an element in which the people who are able to manage their emotions effectively are able to make better decisions, because which they are, the thinking becomes more rational, and in terms of managing the emotion regarding, rather than being impulsive in making those decisions. So yes, definitely in the literature, we do find a connection to that. And in terms of medical education, this has been looked into the clinical decision making as well from the clinician's perspective. So it has been shown to be associated with that also. I hope that answers the question.
So high level of arousal, especially anxiety, which is related to decision making, it sort of affects adversely the decision making process, because cognitive errors start happening. We start jumping to conclusions. That is the first thing that happens in a very high level of anxiety. Then people may start catastrophizing, and because they can not reduce the emotional arousal, they may even delay taking the decision. They may become indecisive even. So yes, emotional regulation has a very strong role to be played in the decision making. Yes, definitely.
Okay, so any other comment from the panelists, Dr. Sonia, Dr. Nagma? Any other point?
Yes, please go ahead, Dr. Nagma.
No,
I'll
no,
follow.
no.
No, please.
Yes,
So
Dr.
I think also emotional intelligence is linked to leadership. And so in leadership, you take a lot of decisions. And those decisions need to be not only appropriate, but also well thought of, logical and sound. So if in a stressful situation, which is the kind of situation we face in medicine, particularly, our emotions are not controlled, and our decisions or in our leadership roles are impulsive rather than thought out, then there is a likelihood of errors happening.
Okay, yes, Dr. Sonia.
And just extrapolating from this point only from Dr. Nagma, I would just add to it that I think the title, thank you, Javeria, it was very striking. I would say a skill that matters, right? And I think stress is an element which each and every one of us faces every day, whether it's a child, whether even it's a toddler, right? Or as we work in, out, whether at home or outside home. So I think the emphasis here should be at a personal level as well, where we are training our healthcare professionals in terms of emotional intelligence as well as students. I think there is a strong personal linkage to it as an individual as well, in order to function effectively from the day in and out of stresses, whether it's maneuvering, the traffic on the road, or just bearing with the hot temperature, or perhaps, even just not listening to your child's wailing all day long. I think even these little bit matters a lot if we think towards it. Just wanted to add that point.
One more point, maybe on the on this topic only, is also burnout. Uh, the burnout that we have in our workplaces, especially doctors, nurses, health professionals, the way there are expectations and their burnout, that may also affect their clinical decision making. So emotional intelligence training can help in that area as well.
Okay, so we will take one more question. We have another question. Could you please explain the difference between feelings and emotions? Yes. And we have, is there any specific tool for measuring or calculating the emotional intelligence? Yes, Dr. Javeria.
Yes, thank you for the question. Yes, again, there are a number of tools available there by the theorists and the researchers there that have been working on different models of emotional intelligence. But again, that the choice of the tool depends on what model you are actually working on, what you are trying to assess. For example, as I mentioned that there is one aspect of emotional intelligence which looks into it as a cognitive ability. So the tool for that is different, because it tends to measure how you perceive and understand facial expressions, for example, of another person. And then if it is taken as a trait or a mixed model, again, the measurement would be different, because it becomes self-reporting, because it's about self-perception of the emotional aspect and the emotional awareness of one might have in oneself and for the other, in which he or she might actually be behaving in a certain situation due to those emotional intelligence taken as a trait. But then again, having said that, as you look into the literature, you will find a number of models, a number of instruments, but again, it comes at the end of the day, it comes to the choice of the model and the choice of the instrument that caters to that model when you are trying to assess the emotional intelligence.
So I would say it's not a very wise thing to ascribe numbers to the qualities that we have. For example, there may be multiple tests of general intelligence as well. Some would be focusing on non-verbal aspects, some would be focusing on the verbal aspect, someone would be, of abstract thinking, which are the various dimensions of general intelligence. Similarly, because emotional intelligence is a multidimensional concept, it is not very fair to label ourselves or someone else as having this number or that number. It happened with IQ, okay, IQ 100 se upar itna hai, 140 se upar itna hai, stuff like that. So yes, it's good to have tests to research, it's good to have instruments to understand people, but I would suggest it should be based on multiple methodologies if you are actually trying to assess a trait like this, rather than using a particular instrument only. That will just give you one side of the whole thing. And because everybody would want to be either emotionally intelligent, or they would have this feeling that I'm not very emotionally intelligent, how do you cover for the factor of faking good or faking bad in self-report inventories? So this, and because we are talking about medical education and we have very little time left, I conduct these counseling sessions with their 5 medical students. And what I have noticed is the area where they lack the most is demonstrating empathy, interestingly. So when we talk about medical education, I think it's very important that we realize, and even as facilitators, how many of us are aware of who do we make eye contact to when we are conducting a session? Is it the person who's nodding the most? Is it the one we feel is sitting at the back, so it's safer to make the eye contact? How much aware are we of ourselves as facilitators? And this is the emotional intelligence, the awareness that would help us grow as professionals. What makes us talk more about a topic? What makes us quiet? Which questions irritate us? Which questions do we feel we need to answer? So it's a very broad thing, and I'm really happy that this topic is being discussed today, but it's a lot of work. It's a lot of work. I mean, we need to start doing it.
Okay, so Dr. Nagma, yes.
I think Sonia was first, so let her speak and then I'll just conclude.
Okay, Dr. Sonia and then Dr. Nagma.
Thank you. And I'll just take a few sentences here. I'm a strong advocate here of not please using numbers and digits to, capitalize on emotions. We're talking emotions here. And I think it kind of lets you go into a tangent altogether, because the point here is not to measure. The point here is more improvement, or perhaps a better understanding of the self. Why do we need to measure that? That is not the point, because a better understanding and self-awareness is a continuous process. So putting a number to it would be, just destroying the entire purpose of it altogether. So with that, I just wrap up. Thank you very much. Over to you, Dr. Nagma.
My take would be a little different to yours, Sonia. And I think we do need to measure. The problem with measurement, assessment as such, is because it's a soft skill. So one, there needs to be multiple tools. Two, there needs to be multiple times that we do it. So rating scales maybe and multi-source feedback probably would help. Also self-report, but self-report measures, as you know, have a lot of biases. So to get a clear picture, we have to kind of go deeper and more broader, and also look at the instead of only relying on the quantitative aspects, look at the qualitative aspects as well. So I think that, and from my own personal experience, because when I started doing my research into emotional intelligence, at that time, there were few studies. And when I looked at the already available instruments, and I was utilizing it in a different context. So most of the instruments are from the European context or from American context, and I was using it in a totally different context, which was Saudi Arabia. I found that the statements that were there in the self-report measures were not understood the same way in that context as it was in the West. So when I piloted initially the instruments that were available, I came to the conclusion that if I administer these the way they are, they're not going to give me the results that are required. And so I needed to then translate it into the local language so that the emotions that we were trying to capture were captured the way they were, because connotations in different cultures are different. So what I'm trying to say here from this personal example is that measurement of emotional intelligence is difficult. One, because of the various, ways the emotional intelligence construct is visualized. Two, because of the multiple theories. Three, because of the, the soft nature of the construct. So yes, we do need to measure it, but finding a reliable method, a method that we can actually use appropriately, will depend on a lot of these things.
Thank you, Dr. Nagma and Dr. Sonia. Any other comment from the participants who have joined physically, or any comment from Dr. Hadia, Dr. Javeria? No. Okay, so with this, we conclude today's session. Thank you I would like to thank Dr. Javeria Rahman. She has presented very well, and for the panelists who took their time out and contributed in the thoughtful discussion. Thank you so much. Thank you.
Thank you.
Thank you.
Thank you. Thank you, Dr. Nagma, Dr. Sonia, and Dr. Hadi.
Thank you.